Ankle arthritis is a little bit different than knee and hip arthritis. I always try and tell patients that our knees and our hips are designed to wear out. Our ankles, the ankle pathology that we see on a regular basis tends to be more trauma related or has some type of secondary arthritis, gout, rheumatoid arthritis, something that has caused the ankle joint itself to wear down. Now with arthritis, generally it's the cartilage lining that has worn down. I always kind of refer to it as kind of like the brake pad in the ankle joint. As that brake pad starts to wear down and you get bone-on-bone contact, that's where the pain it presents. The ankle joint replacement surgery itself, normally we book you for approximately 3 hours for the procedure. We make an incision along the front side of the ankle joint that's approximately 15 centimeters in length. Then we go through dissection to get to the front of the ankle joint itself. Once we have these metal components in, the top portion's made of titanium, the bottom portion's made of cobalt chromium, very similar to that of a knee, then we move forward with what's called the poly, which is basically an artificial version of cartilage that we place in there that is now the new brake pad for your ankle joint. And we put that through active range of motion, make sure that the ankle feels nice and supple. The biggest takeaway with having an ankle replacement is more or less trying to eliminate pain, but allow patients to have a normal gait cadence or gait stride so they can still do a majority of the activities that they'd like to do in terms of working in the yard and going on walks.